the technical glitch. So I hope everyone had a very interesting session since morning. Uh, so now we are going to discuss about critical appraisal. So, like Sriram sir said, it's critical appraisal is a very interesting and also important topic. Um, what I will try to do is I will just try to introduce what is critical appraisal and what are the different tools which we have for critical appraisal, and after that I will try to walk you through an example where we critically appraise a published article and we try to find out what are the issues. So that is what we are going to do now. So the disclaimer is that the views, opinions, information expressed by me during the presentation are my own, and it is not related to any other entity which are affiliated and which I will be affiliated in the future. Um, okay. So, what is critical appraisal? So, critical appraisal is defined as the process of careful and systematic examining the research to judge its trustworthiness, value, and relevance. So, these three terms are very important to understand the relevance of the research for the local setting. Okay, so I hope everybody, most of us can identify this person. So this person is nothing but he's Sapan Desai, and he has been in news for very bad reasons nowadays. Yeah. So why it is, I will let you know in the coming slides. Okay. So before that, can we quickly run through a opinion poll? Uh, so okay. So, if possible, try to fill the answers regarding this. So, what do you think if the published research article, does it have any impact on public policy making or health practice or treatment guidelines? Do you think there is an impact or not? Okay, so I'll just give a minute. Okay, so I can see that there is 100% of I mean people are telling that yes, it does impact on the public health policy making and treatment guidelines, and you are very correct. So in this pandemic situation, I will let me give an example of pandemic itself. Okay, so we recently have seen a paper that was published in the Lancet, so which is most reputed journal. Okay, and I used to believe that if the article is published in Lancet, it is a golden standard, because the Lancet is the ace in the biomedical literature. Okay, so I used to have this kind of opinion before I started reading about evidence based medicine. Okay, so so that is the history, but now we talk about the present. That is, in Lancet there is a multinational registry trial as published. Okay, and the title is hydroxychloroquine or chloroquine with or without a macrolide for treatment of COVID-19. Okay, so in this study, what they published is the patients who are receiving hydroxychloroquine or chloroquine are at higher risk of mortality compared to COVID patients who are not receiving the hydroxychloroquine or chloroquine. Okay, so they concluded that there is a safety concern with hydroxychloroquine, and at the same time they found that there is no significant survival benefit due to the hydroxychloroquine in patients with COVID-19. Okay, how this study is impacted across the globe is that we have seen in the news that India has exported a shipment to Brazil and also Mexico, Brazil, and also United States, some bulk quantities of hydroxychloroquine. Just after that, and at the same time, WHO is running a, global clinical trial, okay, where they try to assess the efficacy of hydroxychloroquine in COVID-19 patients. But this research article has given us a blow, because they said that hydroxychloroquine is no more useful. Instead of useful, it is causing harm because of the increased risk of mortality. Okay, so immediately after the publication, WHO has take a step back, and they said that they are going to pause the international clinical trial which they are conducting. Okay, and at the same time, few countries they in of European nation has stopped giving the hydroxychloroquine to their patient, to their COVID-19 patients. Okay, but however, few researchers has raised concerns regarding this published article. Okay, first among them is the Indian scientists, that is including CSIR and ICMR. They have raised concern. Okay, so they have raised concern that hydroxychloroquine has been used in India from since ages. Okay, but however, we have not observed that kind of extent of mortality in patients who are receiving the hydroxychloroquine. So that is how the initial criticism has started regarding this article. Okay, after that, several criticizing statements has came. So that includes like there is unbalanced baseline characteristics where the patients who are not receiving the hydroxychloroquine are found to have less severe COVID-19 status when compared to patients who are receiving hydroxychloroquine. So that could be the reason. That's why there are uh, better effects, better survival in patients who are not receiving the hydroxychloroquine. And also, they have said that they have connected the data from with 671 hospitals. So 671 hospitals gathering data in this short time is not an easy game. Okay, this has raised concern, and one of the renowned news channel from USA, United States, they have inquired about the list of hospitals they have given in the article. That is, they have started with Australia. So they have checked whether the authors has approached them for the data or not. So the Australian hospitals has given a clearance that they have not approached, and if they're claiming their hospital name, it's a wrong claim. Okay, so that is how they a controversy has started. So apart from so this has given an idea that the authors might have cooked up the data. Okay, so because if the sample size is more, the statistical rigor could be increased. So that's why they could have cooked up the data. So that could be the one of the reason. And apart from that, there were several flaws in the study, in the conducting of the study. Okay, so that has been identified by the ICMR, and also about open letters that were poured up to the Lancet. About 50 to 60 open letters were there criticizing the methods and the results and the approach they have used. Okay, so later what happened is Lancet has retracted their published article, and they apologized for the scientific community. And at the same time, WHO has restarted started the trial back again, and hydroxychloroquine has been used in different nations again. So so the summary of the story which I just narrated is that uh, you know we should not just blindly believe the research article that has been published in a well valued journal. Okay, just because of the well valued journal, we should not trust all the evidence which has been published in that journal. Okay, so we have to critically appraise the literature, and we should understand whether we need to use it or not. Okay. uh, so the next point is like why critical appraisal is important. So as I said, like we might end up in drawing inaccurate conclusions. Okay, this could cause severe adverse events, just like I said. And apart from that, you need to understand whether the published evidence is applicable to your particular question or not. Okay, and these are the different aspects of critical appraisals which you need to take care of. And just I said, if there are only about 2% of published articles, whatever it is, of any study design, there are only 2% of articles which are really clinically relevant. The results on the hypothesis might have been published because the reviewers might have thought it is of value. But a study has done, and which just showed that there are only 2% are clinically relevant out of 100%. That means only 2 articles from 100 published articles are clinically relevant. Other 98 are just for the publication purpose they have published. Okay. um, so actually there is a pitch come from the audience side. So does anyone have any questions?
So please continue with your session, or the Q&A will be at the end of the presentation, sir.
Okay, wonderful. Thanks. Okay, so we might end up misunderstanding the critical appraisal. So some of us might have been thinking like critical appraisal is judging whether the published article is good or bad, whether it is so it is not basing upon judging it is whether it is good or bad. It is judging whether the what are the kind of limitations that particular article have, what are the kind of particular strengths that have, and whether the results are applicable for my purpose or not, for my patients or not. Okay, whether it is able to answer my question or not. Okay, so that is critical appraisal. Critical appraisal does not actually means that it is negative dismissal of a piece of research. Okay, it is never dismissal of a particular research or a particular author. Okay, and it does not always assess the results or a statistical analysis part. It's a critical appraisal is holistic process. A critical appraisal process starts from the title and ends up with a conflict of interest. Okay, so we need to go through each and every section of article to understand and critically appraise the evidence. Okay, so we can jump into like what are the different steps in critical appraisal. Okay, so first of all, like to appraise an article we need to find an article. Okay, like Krishna said in the morning, so we can do a quick search, a quick and systematic search in PubMed, and we can find all the relevant articles for the hypothesis which you make. Okay.
Kapil, sorry to disturb you, Kapil. Can you please keep it in slideshow so that it will be more visible?
Yeah, sure.
Yeah,
Thank you,
thank you.
Krishna. Yeah. So we got the article from these first three steps. Once we frame the research question, where we typically use the PICO method, that is patient intervention, comparator, and outcome. So using the research question, we make a hypothesis, and based on that, we form literature search using PubMed or any other biomedical literature source we have. And based on that, based on our inclusion exclusion criteria, we end up with a few titles, a few articles which are relevant for our purpose. So once after reaching this point, what we need to do is we need to go through each and every article, and we need to understand whether it is relevant for our purpose or not, and what are the strengths and drawbacks of each and every article. Okay, so that is nothing but the critical appraisal step. Okay, so from where we should start from, we should start with the title. Okay, and we should start the title and next abstract and the next of full text. Okay, so what are the clear, why we need to go through each and every session is, for example, like if we are going through the introduction, we can understand what is the background of the research and why they have chosen the particular objective, whether it is clinically relevant objective or not, whether they are going to find any new finding, or whether they are going to generate any evidence to strengthen the already existing hypothesis. Okay, already proven hypothesis. Okay, so what are the different methods? Okay, I will go through this in the coming sessions, but as I said, we need to go through each and every section of the article. Okay, so first of all, okay, so assume that you end up with about 10 articles. Okay, so you picked up the first article. So whenever you picked up the first article, you need to see the title. Title is a very important part of a article. So why I'm telling is, if a well written randomized controlled clinical trial, if we go through the title, we can understand we can understand what is the patient population, what is the intervention, what is the comparator, what is the time period of the trial. Okay, what is the randomization method, where what is the blinding. So all these things are should be given in a properly written randomized control clinical trial title. Okay, so that is why I'm telling. So in the title of the research, what we can find all the important keywords, and what is a brief study design, what is what is the intervention, comparator, patient population, and outcome. Okay, we need to go through this title of the paper, and you can get an idea. Okay, you can get an idea. Okay, whether this particular article is of our interest or not. Okay, just by reading the title, we can just throw that paper, or we can retain the paper for further critical appraisal. So after that, we need to go through the author of the paper. Okay, you might feel right. Okay, why we need to go through the author of the paper, whether it is relevant, is it important or not. As I said, I have shown a picture of a gentleman in my third slide. So I asked, like, can you recognize this person? Okay, so why I put that picture is because that particular author has no scientific background. Okay, but he run a very small data provider company. Okay, so where he claimed that he has about 670 hospital network with access of data of patients. Okay, so this is a very false claim. So this false claim can be, we can understand the credibility of the person based on the company status. Okay, so this is not a very easy task. Network of 671 hospitals is very difficult. So by reading the affiliations of the author, and maybe the specializations, what is the designation of that author, we can get a basic idea, like, okay, whether can I trust. Okay, for example, if first author is a cardiologist and the second author is a physicist. Okay, so at that time we could raise a small suspicion. Okay, so this article is regarding myocardial infarction, and why a physicist is in the author list. Okay, so this kind of initial suspicion, or maybe initial claims, we can make out of the authors and author affiliation. Okay. Okay, so next is abstract. So abstract is, if I ask you, like, what is the heart of a research paper, I will say that abstract is the heart of the paper. Okay, so from the abstract we can get each and every important, I will say important, not each and every detail, but very important details we can get it from the abstract. Okay, so sometimes the abstract can be structured abstract, so where it could be the clear demarcation of objective, methods, results, and conclusions will be there. Sometimes it could be unstructured, so there'll be no demarcation. There'll be just about 250 or 300 words of summary of the paper. So like I said, abstract is the heart of the paper. It will discuss the what is the hypothesis, what is a pico in it, and it also summarizes some methods they have used, and what are the results, and they will also briefly discuss or give conclusions about their research. Okay, so once after judging the title and the abstract, you can get a clear idea whether you should proceed to understand, to read the complete paper or not. Okay. Okay, next is introduction. So why introduction is important is because many a times, as I said, like, there are only 2% of clinically relevant articles has been published out of 100 published articles. Okay, so sometimes many of the researchers have a pressure of publications. Okay, so that's why they publish not irrelevant but not clinically relevant articles. Okay, so whenever there is no clinical relevance in the article, they could have not support their hypothesis. Okay, so based upon this introduction session, you can understand whether that particular author have a clinical clear rationale to do the particular study or not. Okay, so next is methods. To critically appraise a research article, a person should have a clear understanding of study designs, and some basic statistical concepts, like statistical power of a result, type 1 error, type 2 error, and different types of uh, um, hypothesis, and different types of exploratory and confirmatory statistics. Okay, so what will I make sure is, I assume that many of the participants don't know these kind of statistics and study design. So I have selected an article for critical appraisal which is very easy, but which has raised, clinically very relevant points which they have missed. Okay, that we'll be discussing in the commenting section. Okay, in the methods we can see that what kind of study population are they, from where they have been picked up. Okay, whether they are from the primary care setting or secondary care setting, whether they are urban patients or from the rural patients, what is the age of the patients, what is gender of the patients, and from which setting they have taken, what is the specific disease condition they have, what are the comorbidities they have, whether what is the race of them. Okay, apart from this, we also get to understand, like, what is the, for example, if it is a clinical trial, we can understand what kind of randomization they have done, whether they have done any randomization or not. Okay, what kind of blinding they have followed, what kind of sequence allocation they have used. Okay, so these are the different kinds of methods which we can find in the methodology section, and very much which are very much important to appraise a research article. So I just want to give a brief summary of study design. So as we already know that there are different types of study designs are there. So why there is a need of different study designs is because for different problems, different study designs are appropriate. For example, if we want to understand whether a drug should be used in a particular condition or not, for that particular type of hypothesis, randomized control clinical trial is the best research design. Okay, for example, for the same, if we have multiple clinical trials with the conflicting results, at that time systematic review and meta-analysis are the best resource for to understand, to judge or to take a decision. Okay, like Sriram sir just said that Cochrane clinical trial. So among all the evidence available till now, Cochrane evidence is considered as the best and the golden standard evidence. If you end up with any question and if you find an answer from the Cochrane review, you can just blindly conclude that the evidence produced by the Cochrane review group is the final one, because their methods are very rigorous, and for a particular Cochrane review to come, it take 1 or 1.5 year of time. So you can see the effort, and you can also see the methods rigor in that. Okay, so the other clinical designs that includes cohort studies, case control studies, case series, case reports, and expert opinions. So these are in the decreasing order of the evidence level. Okay, so as I said, statistical analysis. So this is again, I considered statistical analysis as again heart of the apart from the heart, many other important sections are there in the research article. One other is statistical analysis. We need to understand what kind of statistics they have chosen, on what is the rationale they have chosen. Okay, what kind of sample size calculation has done to understand what are the number of sample they have to consider. Okay, so what kind of confounding adjustment method they are using. Okay, and how are they handling the difference in the baseline characteristics of the patients. Okay, and on all the statistical analysis plan B is this statistical analysis has done before conducting the study or after the conducting the study. Because if the statistical analysis plan has been formulated after the conduction of the study, it will be definitely biased. Mostly it is mostly biased. But if the statistical analysis plan has been confirmed before conducting the studies, we can be pretty sure that okay, this statistical plan which they have derived is which is in line with the outcome and the research design. Okay, so at this time point, I want to introduce a term called as confounder. What is confounder? So confounder is nothing but it is a patient characteristics, or it's a variable which hinders the understanding the true relationship between a dependent and independent factor. That could be, for example, whether aspirin really decreases mortality in patients with cardiovascular risk. Okay, so in this, obesity could be a confounding factor. If there is a analysis has been done just by performing the odds ratio or risk ratio, definitely they could have measured the importance of obesity as a risk factor for the mortality in cardiovascular risk high patients. Okay, so these are the type of confounders they need to take care of. And next is results. Okay, so whenever we see the results, we need to scrutinize each and everything.
Excuse me, Dr. Kapil. I'm sorry to interrupt you.
Yes.
Can you please repeat the previous slide once again when you're talking about confounding factors? Your signal lost for a few seconds and came back, so we lost in touch with you.
Yeah, sure, no issues, sure.
Just the last part of it.
Yes. So I want to introduce a term called as confounder at this point of time. So confounder is very important topic, and you can find books regarding confounder and it's how to handle the confounders in clinical trials or in other studies. Okay, so first of all, what is confounder? So confounder is nothing but it's a patient characteristics, or it can be a variable, okay, that is regarding the patient, which hinders us in understanding the true relationship between a dependent and independent factors. For example, uh, understand. For example, take a condition. For example, aspirin could reduce mortality in patients with high cardiovascular risk. Okay, so this is a hypothesis. Okay, so here mortality is the independent factor, and aspirin taking is a dependent factor. Okay, so obesity, if the author has not considered about the obesity, and if the author has not adjusted for the obesity in the analysis, and they just conduct analyze the relative risk or odds ratio which is unadjusted for this confounder, we can clearly say that the author might have jumped into a wrong conclusion, because author should understand the confounding effect of other factors, for example obesity in our case. Okay, so they should consider this confounder, and also after that only they have to derive a conclusion. Okay, so this is a confounder, and there are ways to handle the confounders. Okay, so it could be statistical confound. We can as I said, we can use statistical analysis to handle confounding. And also, for example, if we do randomization, so randomization helps them getting patient characteristics which are similar in both the groups. Okay, so this can also, in this way also, we can handle the confounding effect, at least for the baseline characteristics. Okay, so next is the result section. So in the result section, we need to understand three things. Okay, first of all, um, what are the baseline characteristics of the patients? Okay, whether these baseline characteristics of patients are relevant for the hypothesis or not. Okay, for example, if you want to understand the cardiovascular risk in a particular group of patients, but you have taken the patient group which is from 10 years to 20 years. Okay, it is not very relevant because this population.
ఓవరాక్షన్ చేస్తున్నాడు దాని నుంచి చిరాకు దొబ్బుతున్నాడు కావాలంటే బయట పడేయచ్చు
Hello. I think others have to mute. Yeah.
Yeah. Okay. So based on the baseline characteristics, we can understand whether the particular research, done by the authors is relevant or not. Okay. At the same time, if there are, for example, in randomized control clinical trial with the two arms, at that time, what we can see is whether the baseline characteristics in the two arms are similar or not. Okay, so the results are relevant only if the baseline characteristics between the two arms in the clinical trial are similar. It should not be statistically different. Okay, at that time only we can further proceed, and we can say. Okay, and moreover, many of the research articles you can see that the authors used to conclude that our results are statistically significant, and statistically significant, these are wonderful results which we derive. But the actual question is, you know the how clinically relevant are your statistically significant results, that we need to understand. Okay, and sometimes very wonderful studies might have done, and wonderful hypothesis, but because of the lower sample size they might have end up in statistically insignificant results. At that time also we need to understand, okay, whether the sample size is hindering the statistical significance here or not. It is well known fact that whenever there is a lower patient sample sizes happen, at that time the probability of chance take over the true effect. So that's why we might have end up in statistically non-significant results. Okay, so these are kind of minute points which we need to take care in the result section. Okay, like I said, so once after going through the result section, we need to ask ourselves whether the results of study are valid, and what are the results, whether they are in line with the hypothesis or not. Okay, and whether the results are really applicable for the my locality or for my patients, and whether the authors have drawn the conclusion based upon their results, or whether the authors have just cooked up the data and just produced their own conclusions. Okay, so these are the kind of things you need to understand based on the result section.
మొత్తం ఢిల్లీలో ఉన్నారు
Krishna, can you mute your speak mic?
ఉన్నారా చాలా
Okay. Uh,
Hello. Hello. I think everybody has to mute. Hello.
okay. Okay. So the next section of the paper is discussion and conclusion. So in the discussion conclusions, we need to see whether the discussion the authors try to do is based upon their results or not. At the same time, authors need to see, we need to see whether the authors has if there is any previous research already conducted on this hypothesis, whether they are trying to compare those results with the published results. If there is any difference, what is the reason for the difference? So we might not always end up in finding a reason why there is a difference in results between the other published journals and this journal, this article. Okay, so this is because of the chance, or many reasons could be the reason. Okay, so we need to think on those lines whether the author has truly discussed the results and truly tried to map the result with that of the clinical mechanism that has been behind those results. Okay, so these are the different things, and whether the author is giving the conclusion just based upon the effect estimate, or he is also considering about the 95% confidence interval of the results or not. Okay, and at the same time, you also need to understand whether they have discussed their strengths and limitations of the study or not. Okay, so strengths and limitations are the a really painful task for an author to write, because every author who wants to publish their research article think that their study is a golden standard study and there are no certain apparent limitations in this in their research. But author needs to think about the study design, and what and the during the conducting of the study, what kind of limitations they have faced. They need to point out each and every limitation, such that the reader who reads the article can judge whether that particular research article is applicable for their question or for their patients or not. Okay, so apart from the discussion and conclusion, I also suggest you to go through the conflict of interest, and also funding part of the paper. Okay, why this is important is because if a pharmaceutical company is publishing an a research article, and if the authors are there in that paper, there is a high chances that, I mean, not high chances, there is some probability of chance that the results are positive and in support with that of the pharmaceutical company's drug. Okay, so that is why we need to take care of all these little things to draw a relevant conclusion. Okay, so there are in internet you can find n number of critical appraisal tools. For different study designs, we have different tools. For example, in RCT, for RCT, so there are different tools. So tools is nothing but so for example, ROP2, that is risk of bias tool. So in risk of bias tool is nothing but it's a list of questions, okay, which guide you to go through each and every part of the research article and try to judge how they have done and whether it is relevant for you or not. Okay, I will walk you through the in the next slide. I will walk you through the CASP RCT critical appraisal tool. Okay, so for now we just list out all the, I mean, most of the most commonly used tools for the different research designs. For RCT, we have ROB, we have CASP tool, and we have CEBM tool, we have BMJ best practices checklist, we have Pedro scale, we have JEDA score, we have Gate CAT checklist, and many others. For the cohort studies, we have CAS, Big Gate, Sign Methods Checklist, Newcastle Ottawa. So just Newcastle Ottawa scale is most commonly used among all others. Okay, and JBA checklist, Robbins, and a checklist provided by AHRQ. So similarly, for systematic reviews, also we have several checklists. Okay, so till now, I mean, whatever the critical appraisal methods I have discussed, those are applicable for pretty much for RCT. But on the similar grounds, we can also discuss about cohort studies or systematic reviews also. Okay, so now what I will try to do is I will show you a real critical appraisal tool to evaluate the randomized clinical control trial. Okay, so this particular checklist have 11 items. I will walk you through each and every item, and let us see what kind of typical questions a checklist have. So if you've seen, the first question here is, it says that whether did the trial addresses a clearly focused issue. So focused issue is nothing but whether the trial has given the hypothesis very clearly. Hypothesis is nothing but the question. Okay, so whether they have stated the what are the population of interest, which intervention they are doing, or which comparator they have included, and what are the outcomes. Outcomes here could be like primary endpoint or secondary endpoint of the clinical trial. Okay, so we can just after going through the the research article, we could just we should just tick yes, can't tell, or no based upon the research article, and we can move to the second item. So the second item says that, was the assignment of patients to treatment randomized? Okay, so if it is randomized, we could just tick, and if they discussed about the randomization method, okay, and how it is carried out, and how the allocation sequence concealment they have done. Okay, if they have not given details about that, we could just put can't tell, and if they say that this particular method is not done, we could just tick no. Okay, next. So where all of the patients who enter the trial properly accounted for its conclusion. So they want to say that, for example, if the trial has started with 1,000 participants, but at the end for the statistical analysis we just considered 300 patients and we discontinued 600 patients. Okay, so this means that more than 50% of patients who started the study has been discontinued till the end of the phase. So there are serious issues. Methodological flaws will happen, because this could be the discontinuation could be because of the adverse events of the drug, or because of the lack of efficacy of the drug, or maybe the study researcher wants to choose patients who are showing the best results, which can support his hypothesis. Okay, so this kind of flaws could happen. So that's why we need to see this kind of thing. So for this kind of patient flow for RCT, we have a consort diagram, okay, where any published RCT has to show the model flow of the patients, how many patients has been started and how many patients are randomized, and how many patients are taken for consideration of primary endpoint analysis, and furthermore, and what was the reason for the discontinuation, like that. Yeah, so next is the blinding. So blinding is another important aspect of the randomized control clinical trial. So whether blinding has been done, if blinding has been done, whether it is single blind, double blind, or triple blind, they need to give, and so based on that we could just take yes, can't tell, or no. And after that, were the groups similar at the start of the trial? So this particular thing is nothing but so in this question, what we are trying to assess is whether the baseline characteristics of the patients in different groups are comparable or not. If they are not comparable, so that the results are not valid. Okay, so what are the different factors of patient baseline characteristics which we think is like age, gender, race, ethnicity, weight, what is the comorbidities the person has having, what kind of co-medication the person is taking. So these are the different baseline characteristics, and of course there is no typical list of baseline characteristics, but a researcher should understand for this for the particular hypothesis what kind of patient baseline characteristics are important. Accordingly, the researcher has need to publish and also consider the baseline characteristics. Okay, second. So the next sixth question is that aside from the experimental intervention, were the groups treated equally? So I mean to say the co-medication. Okay, so apart from the intervention and comparator, the patient might have receiving other co-medications. Okay, whether the co-medications are similar, okay, in both intervention and comparator arm, or if they are different. If they are different, why the difference happen? So if the difference is there, whether they could hamper the primary endpoint or not. Okay, so this kind of understanding we need to make. So next is like how large was the treatment effect. So treatment effect is nothing but typically it's like a hazard ratio, relative risk, or odds ratio in the clinical trials. Okay, so how large? So how large means so it is not just a magnitude. It is we mean to say like clinical relevance of that. Okay, so first of all we need to understand whether the effect estimate is given for the primary endpoint, secondary endpoint, or not. Okay, if they have given, whether they have mentioned the 95% confidential intervals or not. Okay, and we need to understand whether the primary outcome is given or not, and at the same time we need to understand whether p-value is given or not. Okay. And the next question is, how precise was the estimate of the treatment effect? So precision is nothing but the variance of the result. So so this particular question is based because, for example, if we take a relative risk, and the relative risk effect estimate is about 0.8, and if the 95% confidence of that relative risk is higher than 1, okay, so we can conclude that that particular effect estimate is not statistically significant. Okay, so that is why it is very important to understand the clinical confidence in limits of the effect estimate. So moving on, the ninth question here is regarding whether the the published results are applicable for your population or not. You can just understand like what is your patient characteristics and what is the patient characteristics included in the trial. Okay, whether it is applicable or not, which you need to judge from your side. And the next is clinical importance. We need to understand how clinically relevant is that published information. And next is 11th, as I said, strengths and limitations of article. So I mean, trust me, like I have gone through many research articles till date, and I have seen that where authors have not published the strengths and limitations of their research. Okay, so if they are not published the strengths and limitations, you need to assess yourself. Okay, so what are the limitations of the particular research article which you have gone through? What could be the strengths? And based upon the strengths and limitations, you need to judge whether you should consider that evidence or not for your analysis or for your hypothesis. So these are the different kinds of methods of critical appraisal, and I just have gone through a critical one tool. You might have a question like I have given a very big list of critical appraisal tools. So among this, which one is best to use? Okay, I guess everyone, most of you have this doubt, but try to understand there is no particular or best research best critical appraisal tool for you. It is what you understand each and every minute aspect of an article which you need to critically appraise yourself. Okay, so what kind of methods they have used? None of the critical appraisal list or tool or a scoring manual has given all the aspects which we need to consider to perform a critical appraisal of any article or any research design. Okay, so that's why there is no best tool. It is up to you to choose which tool, and apart from the tool also you need to think beyond the critical appraisal tool to critically appraise an article. Okay, so next is the hands-on exercise. So I would like to take any questions if anyone has.
Uh,
You're not audible.
Hello.
Yeah,
Am
you're
I
not
audible?
audible. Yes, yes. Now you are audible.
So will you take the questions once you're done the hands-on exercise, or you'll take the questions right now itself?
I guess right now I will take, because hands-on is just what we till now learned. So I guess I will take questions right now.
Okay, okay, okay. And the question, just a minute, sir, just a minute.
Sure.
Hello, am I audible?
Yes, yes, you're audible.
Yeah, while you are mentioning about the confounding factors,
Uh-huh.
uh, so you said that there can be multiple confounding factors whenever you're trying to draw a relation between a dependent factor and independent factor.
Yes.
So can these be can these confounding factors be reduced by an appropriate randomization technique?
Okay. Okay.
Yeah,
So yes, to answer your question, yes. So as I said, the confounding effect can be reduced by two methods. The first method is, it's not just two methods. The two conjoined methods, I should say. So first method is randomization. Okay, a properly randomized trial can also lead to patient groups which are not very similar. Okay, so at that time also there could be difference in confounding factors between the two groups. Okay, so at that time, despite our best effort in randomization, if there is a difference in confounding factors, at that time we can do some statistical.
Hello? Am I audible?
Yeah, you're audible. Hello.
I lost it for a second. Is the question answered?
Yeah, question is answered, but in between the connection went off.
Oh,
I think
Mr. Dr. Kapil is not there.
you're right. Yeah. Just check for his mic.
Hello.
Yeah,
Yes,
he's
am I
there.
audible now?
Yes, sir, you're audible
Sure.
now.
So I mean, did I answer your question, or do you want me to explain again? Yeah, go through it again.
Because we lost you in the middle of the journey, so can you repeat it once again?
Sure, no issues. So, so what I'm telling is there are two methods of handling confounding effect. So the first method and the important method is proper randomization. Okay. So any clinical researcher who perform RCT should use a proper randomization method to adjust for confounding. Okay. To not adjust. I mean to say to avoid confounding effects. Okay. But despite of the best effort in randomization, sometimes we may end up in patient baseline characteristics which are different from for two group. Okay, so at that time there are some statistical methods are available which can handle that confounding effect. Okay, but what a caution should be said that the statistical approach of handling confounding is a last resort. Okay, it is not recommended, but it should be used only when there is no other option apart from doing it. Yeah.
Okay, sir. Okay. And when it comes to critical appraisal of this biomedical literature,
Okay.
is this one of the questions that we received was so PharmD students while presenting their thesis in their fifth year or pharmacy practice students doing their second year post graduation. So is critical appraisal of biomedical literature is still applicable to their work also?
Definitely, yes, it is applicable. So, as I said, like critical appraisal is nothing but it's an art, okay, where you try to see, what kind of research design, what kind of hypothesis. Even for the animal studies, we have hypothesis, right? What is the null and alternate hypothesis based upon your objective? Okay, so for any research design which have hypothesis is applicable for critical appraisal. Okay, so
Okay.
like I said, I have shown for critical appraisal tool for RCT, observational studies, and systematic reviews. So apart from that, we do have critical appraisal tools for diagnostic studies, animal studies, and other studies. Yes. So I mean to say that yes, for their work also critical appraisal is applicable.
Okay, sir. Okay, okay. And the next one is so during this critical appraisal, lot of factors were considered. Factors like the region in which the study was conducted, the population on which the study is conducted, the type of interventions that were made. So, do you think all these factors will definitely impact on the final outcome, including the settings where the research is carried out and the settings where the research is carried out and on the people whom it was carried out?
Yes, it's a really wonderful question, I should say, because you know, for example, there is a research study performed in India and another research study is found performed in USA. Okay, so they might come up with a conclusion that patients who are obese. I mean, this is a hypothetical situation. There is no clinical rationale behind it. So they might conclude that obese patients have higher mortality in COVID-19 situation. Okay, COVID-19 patients, obesity is a risk factor for mortality. But the same study which we conducted in India, we might end up that obesity is not a relevant significant factor for the mortality in COVID-19 patients. Okay, so what I mean to draw from this hypothetical example is that the statistical relation between the independent and dependent factor is not linear. Okay, so we have multiple independent factors which could impact the dependent factor. So the relationship between the dependent and independent and within the independent factors is not linear. So we cannot say whether the particular independent factor can influence or not until unless we actually do the statistical analysis. So
So
did I answer your question?
yeah, so the statistical analysis will already be done by the time the results are out, isn't it?
Uh, yes, well before actually. So, for example, if for any research cycle, the research cycle start with a protocol. First of all, with a protocol. Okay. So, in the protocol, the important elements of the protocol is what are the inclusion exclusion criteria of the patients in the study. Okay, and apart from that is the primary outcome, secondary outcome, and the next important part is statistical analysis plan. Okay.
Statistical analysis.
Yes. So statistical analysis plan should and must be, the researcher should lay down the statistical analysis plan well before the initiation of the study, actual recruitment of the patients. Okay. At that time only the bias will be very much less.
Okay, okay. So these were the questions that we have. So you can please proceed on with the hands-on.
Yes, sure. Uh, Okay, so in this hands-on exercise, what I will try to do is I'm not going to follow any tool, as I said. Tools just guide you to how to do a critical appraisal. So instead, what I will do is I will walk you through different sections of a published research article, and what I request the participants is please try to go through the slide. Okay, I mean the contents of the research article, and try to come up with the problems or limitations in the article. Okay, so of course I will discuss the limitation, but you also make up your mind what kind of limitations the particular research article have. Okay. Okay, so now so the situation is none other than this is a situation which I faced during my PhD. Okay, so I did my PhD from Naipur Mohali. So I did my PhD project in pain clinic, PJMR Chandigarh. Okay. um, so my guide is Dr. Babita Gai. Okay, so one fine day, Dr. Babita has came up to me, and she showed an article by this, some Iranian author. The name I cannot pronounce. Okay, so this paper she has showed, and she said that, oh my God, till now I am prescribing patients with vitamin D supplements. I thought that could help the patients with low back pain in reducing their pain. Okay, but this research article has concluded that the vitamin D supplementation is of no more use in patients with low back pain. So she straightforwardly asked, should I stop recommending or prescribing supplementation of vitamin D in the low back pain patients or not? The straightforward question is this thing. Okay, so what you would do? Okay. um Okay, uh, so what I did, as I already completed my evidence-based medicine, I understand her panic. Okay, and after I said that, okay, ma'am, we cannot trust all the published articles. So let me critically appraise the published article. The title is this. Okay, and I'll come back to you. Based on the recommendations, what the critical appraiser says. Okay, so that is what I said. I took a day and I critically appraised it. Okay, so the steps which I followed. Okay, and I will let you know slide by slide. Okay, so the title of the article is the effect of vitamin D on non-specific low back pain. Okay, so okay, what do you think about the title? Okay, so this is a title. Okay, so what do you think about the title? Is the title complete? Okay, I will just try to run a poll so that everyone will be awake, I guess. Okay. Uh, okay. Can the participants enter your response whether the title is complete or not? Okay. So the title is the effect of vitamin D supplementation in patients with low back pain. Okay. So I still just give 20 seconds. Okay. Oh, the answer no is the percentage is increasing. It's a very good sign. I'm ending the poll. Okay, so I could see that about 85% of people are telling that opinion that the title is not complete. Yes, you're absolutely correct. This title is not correct. Okay, so by looking at this title, we do not know. Okay, so this title is incomplete, and we do not know whether it's a randomized control clinical trial or whether it is a observational study. Okay, we do not know what is the comparator in the trial and what is the duration of the trial. Okay, and we also do not know what is the outcome in this trial. Okay, so as I said, a perfect not a perfect, I mean to say a well written title for a randomized controlled clinical trial is very much different. If I ask, if the authors has asked me to put a title, what I might have put is uh, a randomized controlled clinical trial to assess the effect of efficacy of supplementation of vitamin D in reduction of pain in patients with non-specific low back pain. So this is the kind of title which I might have given for this particular paper. Okay, so maybe once we go through the finish the paper, you might have end up with a different title, which could be definitely better than what this the title the authors has given. Okay, okay. So once after reading the title, what we need to do is we need to jump it to abstract. Okay, so I mean before that we could also seen you could see the what are the authors and what are their affiliations. Okay, so all these authors are they have some medical background regarding the low back pain, and these authors could be, I mean the piece of research could be reliable based upon the author affiliations. Okay, so after going through the title we end up in the abstract. Okay, so I will myself mute for a minute so that participants can read the abstract. Please trust me, after this hands-on exercise is very interesting and very important for you also, because it is thought provoking. So try to go through the abstract. I'll mute myself for a minute. Okay, so let me summarize. I guess many of the participants is complete reading. If you're not, just I will summarize for you. Okay, so what this abstract is essentially saying is that so the goal of the study is to evaluate the effect of vitamin D administration, okay, on improvements in chronic low back pain. So So they are not clearly mentioned the primary endpoint of the trial, but they just said that what is the effect of vitamin D administration. It is not supplementation. They want to say administration. Okay, so this is not very clear objective as of my sense. And the next what they have done is they performed a double-blind randomized control clinical trial, okay, in 53 patients. Okay, so they have randomized 53 patients to two groups. One is vitamin D supplementation and another is placebo. Okay, so in the in the vitamin D group there are 26 patients, and in placebo group there are 27 patients. So to these patients they have given vitamin D supplementation and placebo, and the patients are aged between 18 and 40, and their vitamin D levels are below the normal. So the Endocrine Society of India recommends, National International Endocrine Society has recommend that about 75 nanomole per liter is the normal vitamin D levels. But these patients has find to have like about 18 nanomole per liter, which is less. So that's why they might have given supplementation of vitamin D. And you could see after the supplementation for 8 weeks, 8 weeks there is a significant statistically significant increase in the vitamin D levels. And at the baseline they also assessed the pain score. So pain was assessed using VAS, that is nothing but visual analog scale. So visual analog scale is nothing but out of 0 to 10, okay, how much the patient is suffering with the pain. If the patient is suffering from no pain, the patient might have given the VAS score as 0. And the patient is suffering the hell lot of pain, the patient might have say that the VAS score pain is something about 8 or 8, 9 or 10, okay, based upon the severity. So higher the VAS score says represent that the patient is suffering from higher pain. Okay. Okay, so and in the result section they also said that there was a significant improvement in the pain score within each arm. So within each arm means like after taking the vitamin D supplementation, patients in the vitamin D supplementation group improved the pain, means there is a reduction in the pain, and the same is the case with placebo. Okay, so after the giving the placebo, patients are significantly improved on the pain score. But however, when we compare the pain score, improvement in pain score between the treatment arm, that is a vitamin D supplementation group, versus placebo, there was no significant difference. Okay, so based upon these results, they have concluded that vitamin D3 has there is no significant difference. There is, they mean to say that there is no significant impact of vitamin D supplementation in low back pain patients. Okay. uh, so let us see, broadly. So these are the kind of points which they have missed. Okay, so they have not clearly stated the what is the outcome of the outcome definition, whether improvement in the pain score and how much improvement in the pain score they are hypothesizing. Okay, and what is the data on co-medication, whether patients are taking any co-medication. Co-medication means typically low back pain patients typically take amitriptyline, pregabalin, and different NSAIDs. Okay, these are the kind of medication they take based upon the pathophysiology of the low back pain. So they are not considered what is the co-medication usage. Okay, they are not given. Okay, and the inclusion exclusion criteria is it is very simple. It is just based upon 18 to 40 years, and they should be urban population. So that's it. So they have not considered what kind of work history the patients have, whether they are using whether they lift the heavy weights or not. Okay, how much sun exposure do they have. They have not considered all these relevant confounding factors. Yes, this is how. So they have not considered these confounding factors, and they have not mentioned in the abstract. Okay, and the most important thing is like they have not the sample size, the 53 is for this kind of trial is too small, I should say. They have just taken the 53. The authors might be dreaming that 53 is sufficient, because they have not done the sample size method. So they cannot justify this 53 patients will be sufficient for to draw this kind of conclusion. Okay, and the follow-up is also like just 8 weeks. So typically 8 weeks is just 2 months. Okay, so to see the effect of vitamin D, many of the other clinical trials has given done the clinical trials for at least 1 year or 1.5 year to understand the impact of vitamin D. The benefit of vitamin D in low back pain. Okay, but these authors are in hurry. They just did for 2 months and they have concluded the evidence. Okay, so apart from that, there is a difference in baseline characteristics. Just like I said, the pain score is different before uh, starting of the trial. Okay, this I will show in the next slide. Okay, and they have not considered whether the data is normally distributed or not, and what kind of statistics they will use based upon if the data is normally distributed or not. Okay, so there are many lacunae in the research and at least in their presentation. Okay. Okay, next is introduction part. So introduction part, why I just focus this. If you can go through the introduction part for a minute, I will just mute myself. Yeah. Okay, so just to summarize the introduction section, so there are only 3 points out of this long, 200 long introduction section. The only 3 points is that they say that vitamin D has some, physiological role in, subsiding the inflammation, which could be correlated with the chronic pain in the low back pain patients. Okay, and apart from that, they say that there is a conflicting evidence in the role of vitamin D in low back pain. And the third important point, but they are not given it completely. They want to evaluate the effect of vitamin D on improvement of low back pain by conducting this randomized double-blind clinical trial, since there are few studies based on this experimental design. So you see, the authors are not really clear about what are they are trying to do or what they have done. Okay, so for example, if we are trying to write an hypothesis or an objective for this introduction section, so we might have done better by giving what are the patient groups and what is the intervention, what is the comparator. Okay, and also why they have chosen that particular dosage of the vitamin D, or what is the duration they have considered, why they have considered the particular duration, or etc and etc. Okay, so these are the different points there which they are lacking. Okay, so apart from that, the authors has not very clearly stated, whether the patients who are with low back pain, are they really deficient with the vitamin D. If they are deficient with vitamin D, are they hypothesizing that by supplementation with the vitamin D to get or to make the normalize of the vitamin D levels in the patient, by the normalizing the vitamin D levels in the patients, thus the pain is reducing, or whether the vitamin D itself has a anti-inflammatory activity. I mean to say, which acts as a anti-inflammatory agent and reduces the pain in vitamin D in low back pain patients. Okay, so these are two different aspects of vitamin D which you need to consider. Okay, so they're not very clear about their hypothesis, how they are proposing the usefulness of vitamin D in these low back pain patients. Okay. So next is methods. So I request you to go through this method section more carefully. Okay, I will also mute again for a minute and please go through it. Okay. So basically, in the method section, what they try to do is they mentioned that it's a randomized blind control clinical trial. Okay, so the randomization method is based upon the age and gender, and the inclusion criteria is like the patients who have chronic low back pain, where the chronicity of low back pain is defined as the patient suffering from back pain of greater than 3 months. Okay, of greater than 3 months, and after that the patient should be 18 to 40 years, and apart from that, the patients who are with specific reason of the low back pain only they have included. Apart from that, they said that they are supplemented with vitamin D levels irrespective of the vitamin D levels of the patient. So here they said that if the patients have more than 75 nanomole per liter of vitamin D also, they will be supplemented with vitamin D. But the rationale is not given here, which is a very clinically important rationale that should be considered. Okay, so they have given the randomization method they have followed, and apart from that, they said that the patients could have are allowed to take celecoxib, which is an NSAID. Okay, if the patient is suffering from unbearable pain. Okay, but this raises a significant concern, which I will explain later. And apart from that, they have given the estimation method of serum vitamin D levels, and and they have taken the IRB approval for the study. Okay, so what are my concerns? What are my concerns with the method section? So here the study subjects enrollment was not clear. Whether all the consecutive patients who entered the the clinical setting are included, or whether the clinician has chosen, based upon his will, okay, to select the patients into the study. Okay, and it is also not clear that how many number of patients were screened, how many were randomized, and how many are failed to randomize, how many are failed to follow the protocol. What is a when the patients will be excluded from the study, what is the criteria of exclusion, whether the patient take any other medication apart from celecoxib, that is why they have excluded, or what is the exclusion criteria. So they have not mentioned anywhere about this. Okay, so like I said, patients who are with vitamin D levels less than 75 nanomole per liter only should be supplemented with vitamin D oral supplements. But in this study, there is a contradiction between them. Okay, so they didn't say this thing. So these are my top line comments regarding the method section. So the next section is statistical analysis. Again, this is a very interesting and important section. I will just give a minute, try to see what are the points they have mentioned in statistical analysis, and let us see what points they have missed. Okay, I will put myself on mute for a minute. Okay, so I'll just review the statistical analysis methods they have given. So basically, they have given nothing in the statistical analysis apart from just telling that they compare the pain scores and vitamin D levels, that is at baseline, and also baseline with after the post intervention or post 8 weeks. So that is what they said. They said that the continuous parameters will be tested using t-test and categorical using chi-square test, and the level of significance is 5%. So that is all they have given for statistical analysis. They might have given much more than this. Okay, so let us see what all they could have given. Okay, so they could have given how the sample size has been calculated, how they end up with 53 numbers. Okay, 53 patients. Okay, like they have not tried to understand, for any statistical analysis to be performed, they need to understand what are the baseline variables and what are those distributions. Okay, if a particular variable is falling, falling in a normal distribution, we follow particular statistical methods. If it is not following normal distribution, we follow different statistical methods. If it is following beta distribution, we assign different types of statistics for that. Okay, so these are the different underlying distribution of data should be understand before performing any statistical analysis. The author did not try to attempt to understand or at least plan the kind of distributions the variables have been in the study, and accordingly they have framed the statistical methods. They just define the statistical methods, despite of what distribution the variables follow. And nowhere, I mean, nowhere the authors has discussed about the confounding factors. Okay, what are the confounding factors that could hamper the results? Okay, and how they have been handled. Okay, so I will show you the how they have, you might say the first method of handling the confounding factors is by proper randomization method, but they failed randomization. I will show in the next slide. Okay, so there are several flaws in statistical analysis method which they have reported and which they have done. Okay, so the next is result section. So in the result section, what I urge you to see is you try to compare the baseline. So first of all, you try to see what are the different baseline characteristics they have seen, okay, considered in the study, and you try to compare the difference in the baseline characteristics between the drug arm and the placebo arm. So drug arm is nothing but a vitamin D arm, placebo arm. Okay, and you try to see the p-values. P-value says whether the results are statistically significant or not. So p-value which is less than 0.05 is statistically significant. Okay, so you need not to go through all these things. Okay, you just go through this table and this 4 lines for me. Okay, I'll just give a minute to go through it. Okay, okay, so now I will walk you through the results. Okay, so if you have seen, okay, they have considered the baseline characteristics that includes gender, age, weight, height, and BMI, pain score, and the vitamin D levels, serum vitamin D levels. Okay, so I worked, I mean, about 5 to 6 years in a low back pain area, and I understand what are the different confounding factors that could confound the effect of, vitamin D in these patients. So that includes what is the type of, work they do. For example, a software engineer who typically sits for more than 8 hours, okay, in an uncomfortable position, can have a different impact. Okay, because they might have not have a well sun exposure, but instead there could be some labor who lift heavy weights and they have ample amount of sun exposure. So these are the different factors. Apart from this, there are several factors, of course. So these are the different factors, okay, which could confound the effect of vitamin D. Okay, so apart from that, you can see here the VAS score. The VAS is nothing but the pain score. The pain score in the drug group is 5.42, which is, it is out of 0 to 10, it is about 5. But in the placebo group, it is 6.44. If you see the statistical difference, here it is statistically significant. It means that the pain score in vitamin D group is significantly less than the pain score in the placebo group. So here the articles, here the authors are telling that basically they failed the randomization because there is a significant difference between the very important confounding fact, a very important factor, that is pain score, which are not similar in both the groups. So whenever the authors have done this baseline characteristic analysis, they might have stopped doing any further analysis. Instead, they should have not published this article. But however, they thought that they will go ahead and they will publish this article despite they have failed randomization in the process. Okay, and this failure is because of the poor randomization
Sorry
method.
to interrupt you.
Yes, go
Sorry
ahead.
to interrupt you.
Yes,
So this the VAS score that you have just showed,
yes.
is it before the intervention or is it after so these are the baseline VAS values or the values that is obtained after 8 weeks?
Okay. I got your point. So let me tell you the study method in a layman language. Okay, so what they have done, is they have gathered few low back pain patients. Okay, and after that, what they have done is they have measured two things. One is the pain score, and other is vitamin D levels. Okay, so they have gathered the data of pain score before giving the intervention, and they confirmed that the pain score in vitamin D group is 5.42, and the pain score in placebo group is 6.44. Okay, and they assess the vitamin D levels, and the score is about like 17 and 19 nanomole per liter. Okay, so these are the
Okay.
patient baseline characteristics. After that, they have
Baseline
given.
characters. I got you.
Yes. After that, they have given vitamin D supplementation for 8 weeks and placebo for 8 weeks. And after that, they measured the pain score and vitamin D levels again. And after measuring these two, measures, what they have done is they statistically compared, the difference between the baseline pain score and the post follow-up pain score. They similarly they have done for vitamin D, and after that they have done another statistical analysis where they have compared the pain score, that is post follow-up, between the two groups, that is drug group versus placebo group. Okay, so based upon the pain score at post follow-up between the drug and placebo group, they have drawn the conclusion. Okay, so are you with me? I mean, is the method clear with everybody? If there
Yes,
is
sir.
any
Yes, sir.
question, if there is any question, I can take right now regarding method.
Yes, sir. It's clear. You can go ahead.
Okay, sure. Okay, so you can see I already said, so there is there is imbalance between the pain score at baseline, which it should not be. Okay, and if the baseline characteristics are not similar in the two groups, there is no point in conducting the clinical trial. Of course, if it is, for example, if it is just like gender, there's a gender difference between the two treatment groups, they could have done some statistical analysis. But if the pain score, which is the primary outcome, which itself is not balanced between the groups, there is no point in conducting the study. So this is one of the critical issue in the results. Okay, so as I said, they have not considered all the typical patient characteristics for the analysis. That includes the work nature and sitting poor. I mean, high risk. What are the different risk factors of the low back pain that is pertinent to the this one. What you say, work culture and other things. Okay, so the next part of results, what they have given us, they have given the primary outcome and primary outcome. So I will just give a minute to please go through it. Of course, I will summarize, but you try to go through it for me. Okay, so I will try to summarize for you. Okay, so there are three important points out of this entire result section which we need to consider now. So I will start from the back side, from the end of this result section. So in the end of the result section, they are telling that in the treatment group who were supplemented with vitamin D, there was significant improvement in the vitamin D levels. Okay, so I mean this is really not a very correct method, because if you see the serum levels of the patients in vitamin D has increased from 17 to 27. Okay, but the normal levels of the vitamin D levels in a patients in a typical people is about 75. So they have not achieved the required increase in the vitamin D levels in the patients with low back pain. So despite of this, they confirmed that okay, they have supplemented vitamin D and they want to try the see the effect. Okay, which is not clinically significant. Although they have attained the statistically significant improvement here, it is not clinically significant improvement in vitamin D levels in patients with chronic low back pain. Okay, so this is the first flaw in the results. And the next is what they did is they just compared the VAS score before treatment and after treatment in the drug group. In the drug group, there was a significant decrease, statistically significant decrease in the pain score, that is 5.42 to 3.03, and the same in the placebo group also. There was significant decrease, that is from 6.44 to 3.11. So they're telling that there is statistically significant difference. But however, so the VAS, that is a pain score, typically many research has established evidence that if there is a difference in VAS score of about 3 points, okay, if there is a difference in 3 points, it should be considered clinically significant results. Otherwise, it is not clinically significant. For example, here the score is 5.42. If I subtract this 5.42 with 3, the value will be 2.42. Okay, but here the patients have attained 3.03. Although this decrease from 5.42 to 3.03 is statistically significant, it is not clinically significant. So this kind of conclusion has not been drawn by the authors. Okay, they just stick to the statistical significance and they forgot the clinical significance. Okay, so this is my second critique on this result section. So my next critique is, basically there is a significant difference in the VAS score between treatment and comparator. Despite of that, they said that at the follow-up are these bars, these small bars. Okay, so this is the treatment bar and this is the comparator bar. There is similar. This is 3.03 in the treatment arm and 3.11 in the comparator arm. So when this compared 3.11 to 3.03, obviously they will end up in a statistically insignificant result. Okay, so that is how they come up. Okay, and this is they drawn a conclusion that vitamin D is no more useful in patients with chronic low back pain. Okay, and after that, you can also see that the any basic statistic textbook says that t-test should be done only in when the patient sample size is ample, so that it follows the normal distribution. But they are not checked for normal distribution of the data or not. They just apply t-statistic, which should not be applied typically in this kind of analysis. Okay, so apart from that also, there are advanced statistical methods which they could have done to draw the conclusion instead of just comparing the means between the two groups. Okay, they could have performed a regression methods. Okay, where they can adjust different baseline characteristics which could hamper the results. Okay, so they just neglected all of these things and just they performed the analysis. Okay, so these I already covered these comments. Okay, so based on this, uh, what do you think, uh, whether so I will come, we'll go back to the question from Dr. Babita Gai. Okay, so okay, the question is, she wants to understand whether she has to stop prescribing vitamin D for low back pain patients based on this particular article which he has given to me. Okay, so next day I have gone, okay, and I spoke to her. Okay, at that time, what answer should I give? Okay, uh, just a second, I will just write the poll here, poll question here. Okay, so should I recommend him? Okay, recommend her to stop supplementation. Okay, of vitamin D based on the evidence. I mean, evidence means the article which he has given. Stop supplementation or should not stop. Okay, so okay, so please try to answer my poll. What kind of response should I say? I will just give you 30 seconds to say like whether should I ask her to stop supplementation based upon the article which we gone through, or should I say that you might have referred to different another more rigorous article, or you can go forward and supplement it. I can see the should not stop supplementation. The percentage is increasing gradually. It's a good sign. Okay, I'm ending the poll. Okay, so most of you are absolutely correct. Yes. So in the next day, what I said is, no, you should not stop, because the evidence given in this study is it is not reliable. Okay, and it is not even applicable for the patients which he is treating. So that's why I recommended not to stop the treatment. Okay, so the wonderful thing is that, so after talking to her, I got an idea why I should not publish, okay, a commentary on this particular article. Okay, I, along with my younger friends, what we did is we published this article of commentary. Just a second, please. Okay, can everyone see the this PDF?
Yes, sir.
Okay, wonderful. So what we did is we wrote a comment to the editor asking the authors to explain the flaws, and if there are flaws, they could have mentioned it. Okay, so you could see this is the Dr. Babita guy which I was speaking about, and Dr. Deepika Bansal, she is my guide, and this is me, and this is my younger colleague. Yeah, so we come up with a kind of small publication just to alert the research committee that this paper is not reliable, and unless these questions are answered, we should not maybe consider this particular research that has been published in this article, in this journal. Okay, so I mean, yes, that is what we did, and that's why I have chosen this particular articles for critical appraisal. So does anyone have any questions?
Hello. Any questions from the participants? Hello. Hello.
Raghav, go ahead.
Sir, I'm there, sir. I'm there, sir. I was just last while trying to recollect some questions that I wanted to ask. So, sorry. There?
Sriram sir, by the time you have anything.
Kapil?
Yeah.
Yes, yes.
Any questions are there, or can we conclude?
Sir, Sriram sir, actually I wanted to ask you a question before itself. So since I have got time, I want to ask you this. Actually, this question was received by the time we ended the first session in the afternoon. Unfortunately, we couldn't ask because the question came very late. So can I ask it now?
Yeah, please.
So when you were discussing about this rapid approval of drugs during that cancer chemotherapy session,
Yeah.
that is when this question says whether compassionate use of investigational drugs, are they allowed by CDSCO?
Voice is breaking. Can you just pronounce it once again?
Whether compassionate use of investigational drugs are allowed to be used on patients by CDSCO.
See, compassionate, what do they mean? I don't understand. See, investigation new drug is again to be used with permission only. Is isn't it?
Yeah, probably the question might be that a drug which is still under investigation, which is not yet approved, can it be used in patients who are having like who are facing end life mortality or morbidity, something like that? Might be the question by that.
I think the local CDSU authorities have to give permission for that. See, in this case, in COVID condition, that is what is given for remdesivir. India has
Okay.
approved it. India has approved it even though it is there in the preliminary stage, right? With
Okay.
all the other, even though it has not crossed all the 4 stages or post-marketing, all those things were not done. In spite of all those things, seeing the pandemic condition, they have approved it for use in patients where it is really required.
Okay. Okay. I think Dr. Kapil is not yet there, but I would like to ask this question.
Yes, yes, I'm here.
Krishna, sir,
He is there in his car, yeah.
is, are you there, Dr. Kapil?
Yes, I am.
Okay. Uh, so while you were dissecting the journal stepwise, somewhere in the methodology you were talking about the distribution of the sample, and you said that the author did not mention about how the sample was taken or the distribution which was taken into consideration.
Yes. So, so why I raised that point is because, uh, so typically, like when we take smaller sample sizes, okay, for example, in this article, they have just taken 27 or 26 patients in each group, okay. So when we have lower sample size, the statistical power, I mean to say, the rigor of the statistics or results is less, okay. So at that time, what we need to do is beforehand we need to perform some test whether the the age, for example, if we take age, okay, it's continuous variable, if it is following the normal distribution or not. If it is not following the normal distribution, we should not represent them with age and standard deviation, a mean and standard deviation. Instead, they might have taken median and interquartile range, okay. So when they take median and interquartile range, at that time they should not use t-test, okay. They could have used non-parametric test. Okay, so that is why I raised this point. So beforehand performing any statistical analysis, we need to see whether there is sufficient data to perform normal distribution or not. If the variables are not performing normal distribution, we should apply different statistics that are called as non-parametric test. So that is why I have raised that point.
So one more thing that I would like to ask you is, so before we start any clinical research, it becomes a mandate to calculate the sample size and the power of the study.
Yes, it is.
So after we calculate the sample size, then with that statistical equation, we'll be given with some number.
Yes, please. Yes.
So there can be some situations where we cannot recruit that number. So is there a still possibility to carry out with the number that is available with us, or is it a mandate that you should have those numbers? As
Yes, so in the ideal world, like I said, okay, what are the patient numbers you calculate that you will try to, recruit them. But of course, if if it is not possible to recruit that required sample size, okay, at that time, what the authors try to do is they try to change the clinically relevant difference which we use for statistical analysis to generate the statistical, sample size calculation. So they defer that, and along with that, they try to, put the reduce the significance level from 5 to 10%. Okay, at that time they allow the chance of error to be a bit high. Okay, when we increase the chance of probability from 5% to 10%, at that time sample size will be less. Okay, so they try to do some statistical steps. Okay, along with that, not only the statistical steps, I want to say, along with that, these two have clinical implications. Okay, so that is how they come up with a different approach of clinical trials. So they will be more pragmatic. Okay, they will not stop the clinical trial if they have recruited maybe like 30 or 40% or more than of trials. If you see in the clinical trial registry, many of the clinical trial titles says that the clinical trial stopped because of the study investigators are unable to recruit the required sample size. Okay, so you can end up in different situations. So it is solely up to the study investigator whether they could go forward with the available thing or not. Yes.
See, there is one more
Okay.
thing I
So,
think you can recollect and say that it is the snowball recruitment. There is one called the snowball recruitment. That means during the process of the trial, uh, uh, if they could come across in that particular place or in that particular zone, if they come across a particular group of people, whether the geriatric or whatever the group they wanted, if they come across, they can include them in the trial, and we call it a snowball recruitment. Um, I don't know to what extent is applicable in that particular clinical research, but there is one thing like that.
okay, sir. So the article that you have just discussed, they did not mention anything about the sample size or the sample requirement that is required to get a possible outcome in this condition. So why do you think that such kind of publications still go on? Is it just
Yes.
because that you mentioned about the peer pressure or the publication pressure, or can there be any other factors?
No, so if I understand correctly, like if they are not calculated samples and if the sample size is very less, why you have gone through the complete article? Is it?
Yes, sir.
Is it?
Yes.
Yeah. So, apart from sample size, there could be other factors. Okay. If I go to the clinician, if I will say that, okay, this is based on sample size, you can just reject this paper. She will not be, convinced because of my judgment. Okay. I mean, based upon my critical appraisal skills. Okay. So, I should explain her step to step what are the deficiencies in that paper, apart from the sample size. So, that is why you
I'm
have
sorry.
gone through
I'm
complete
s-
list.
I'm sorry. My question wasn't that.
Okay.
My question was, the article that you have just reviewed does not have does not mention any method how the sample size was calculated and did not give any idea about the power of the study, etc. My question was, such articles which don't have a standard method for this patient recruitment, sample size calculation, how can they still be published?
Um,
Is it
See,
because of the
publication depends on what type of journal they publish. There are a lot of
yep.
journals where they accept all these things. Within 2 days, they accept. See, just
So,
for the purpose of showing the audience, these are the things which are lagging, particularly appraisal. This topic is critical appraisal. That is where he has taken that particular article where a lot of mistakes are there. Critically, he is surprised and he has shown the example from there.
Yeah, exactly. So we got a question which is asking, which asked us saying that how can research articles be published in the absence of sample size? Can research articles be published in the absence of power of the study? So I thought I would like.
That's what it might not be there in the index journal or accredited journals.
So, I mean, just to add, this rheumatoid journal. I mean, it's kind of one of the renowned journal in this. Of course, not the so significant impact factor, but it's index journal, PubMed index journal. Okay, so at least we can rely on PubMed index journals a little bit instead of unindexed journals. But this kind of article in that journal is really, it is appalling. So that's why we wrote a, commentary on it, because this could mislead a few clinicians, undermining the, usefulness of vitamin D in chronic low back pain patients. Okay, so that's why, I mean, we just write, and there might be like the reviewers are not, well versed with the, statistics, or not well versed with the, low back pain condition. So that's why they might have approved, or it could be of any reason. Definitely not a scientific reason. Yes.
Okay. Okay. So the last question for today, sir. During your discussion, you mentioned that we have to identify the sample. If it is falling under normal distribution, you have to follow some t-test, something like that. And if it doesn't follow normal distribution, then you have to go for non-parametric tests. And you just showed a bit of the comment that you gave it to the original editor, saying that Wilcoxon rank test was more appropriate than pair t-test, if I'm not
Yeah.
wrong.
Yes. Yes.
So which is a lot of statistics. So can you suggest the most appropriate way in which because majority of the family curriculum is more concentrated on the hospital sector, where people learn a lot about clinical pharmacy, a lot about pharmacotherapeutics, a lot about hospital pharmacy. But the topic that especially you gave is more related on statistics. So just a hint how students can equip themselves in statistics rather than these regular subjects.
Yes, sure. So definitely, like I gave my statistics exam like during my M.Pharm. Okay, that is my post graduation. I many times after during my PhD, I regret that why I have not gave my statistics the best attempts, because in post graduation or in before that, we just study the theoretical aspects of the statistics without understanding how important are they in our future. Okay, so that's why. So what we can do is there are several online freely available courses. For example, in EDX, okay, EDX, there is a course on medical statistics. Okay, so
EDX.
yes, EDX, yeah. And there is another source that is called as Coursera, Coursera. So in these both platforms, okay, University of Harvard, University of Stanford professors used to teach statistics. Okay, that too from basics. Basics means we can understand what is meant by central tendency. They start from that level, and they end up you in getting into like time series analysis, which I consider as the most advanced, for a level of PG level. It is a time series analysis, a kind of advanced level. So that is what I think. So in both these platforms, that is Coursera and EDX, we have freely available resources, which students can start, going through them.
Okay, sir. So thank you so much, Dr. Kapil. That was a very, very interactive session with you. And we thank you for your time. We thank you for your valuable information. And we also thank you for the critical appraisal that you gave with a very live demonstration. Thank you so much. And with this, we successfully completed this online workshop. And before we leave, I would request if somebody has to say any word before we leave for vote of thanks.
Yeah, I would like to just say a few words regarding Kapil's talk, lecture. It was
Sure,
really
sir. Sure, sir.
extensive one. At the same time, he has made it very live for the student level understanding. So he has mentioned how to critically appraise an article, and also he has told the individual section wise. He has explained in a very easy and understandable manner. And also the different tools for critical appraisal is also discussed here with. And he has taken an example from the Lancet and explained very well. And hands-on exercise with specific example given is very useful and highly informative. Thank you, Dr. Kapil, for your time as well as the way of expressing things, and individually you have dissected and taken the demerits and merits of individual article, section wise, and I'm sure the students who have participated in this will be benefited out of it. Thank you so much for your time and efforts.
Thank you, Sriram sir, for your kind words.
Thank you, Kapil. You narrated the entire session very well. I hope all the participants got how to critically analyze an article. You have given all the examples, and the very good part is you have shown the corresponding letter what you have written based on the findings identified from that article. It's very good. Hope all the participants got benefited out of it. And the participants need to understand one thing, that critical appraisal is not that easy what you learn in the morning literature such. For this critical appraisal, at least we need to have some aspects, like at least we need to have some subject understanding, and we need to have at least some basic methodologies of the pharmacoepidemiology and the clinical science, and we need to know at least some basic statistics. Without statistics, we cannot even understand what we mentioned in the article. So some basic statistics we need to have, and also we need to operate in common sense, like how Kapil explained that even before the baseline, the values are not matching. So how it is going to match after that? So kind of common sense we need to apply. So these things we need to have certainly for critically appraising the research. I'm sure that all of you are going to be gain that knowledge. It is not difficult. Even me and Kapil were not knowing all these things in 2012 when we are studying M.Com second year. But after that, within the span of 7 years, we learned some of these basics, and I think that's why we are explaining today. So it is not that all of the things we say today. There may be some other aspects, but you can certainly learn all those things from other sources. Thank you very much.
Exactly, sir. That is the point that I was exactly mentioning, because all family students will have biostatistics in their 4th year, and you people will have it in 2nd year and masters in pharmacy. But by the time we complete it, I don't think we have so much understanding that we can imply it directly into the appraisal of literature. So it's a step-by-step process that we grow. So I had this,
Exactly.
actually I wanted to express it with Dr. Sriram, that
Yeah.
how can this be incorporated right from the beginning itself, so that the student, by the time we go, because 5th year is the year where we concentrate on thesis, and exactly 4th year is where we have biostatistics.
See,
So
I tell
I
you
think,
one thing very frankly. So it might be a little harsh. Um, See, statistics is not actually our work, right? We have to have the help of the statistician. Within 6 months or 1 year of study of statistics, you cannot be a master of all statistics. And as Dr. Kapil was telling, there are a lot of courses, even the Coursera, he has mentioned it correctly, in Coursera, the University of California, University of Harvard, everybody is giving a certificate course on that, statistics. It is really useful. I have gone through that. It's really useful. Only thing is, students have to apply it. It is not that they study and they forget. The problem with us is we don't apply. Just once in a while, you do a project, and that particular time you wanted to find out which particular statistics is useful, whether SPSS software is available or not. So in that case, you can rely on a statistician. You give the inputs to the statistician. Before you start the project itself, you have to have a discussion with the statistician. This is what I'm going to do. What are the statistical? What are the methods available? And how much should be my sample size? All those calculations should be done well prior to the project, not after getting all the details of the study. So prior to the project, if they were able to contact a statistician, I am sure they will have a very good statistical. The project can be undergone with good statistics.
okay, sir. So thank you, sir. With this, we have successfully completed the 1-day online workshop on critical evaluation of biomedical literature in clinical pharmacy. And I would like to conclude this session by thanking a few people. At the outset, I would like to thank Mr. Sunil Chiplankur, Group Pharmaceuticals, and Karnataka Registered Pharmacist Association for again trusting in us and giving us this platform so that we can organize this. And next, I would definitely thank Dr. Sriram. We totally understand how important it is to have you with us the whole day. We understand how busy you are. We understand how difficult it is for you to spare the whole day for us, but you did it for us, and we are very glad to be associated.
I'm always happy to be associated for any professional activities. Right? This is
Thank
the
you, sir.
profession, not for the usual.
Yes, sir. Thank you, sir. Thank you, sir. Thank you for your time. You have been there with us the whole day, and we'll definitely look forward for you. And I wholeheartedly, from the bottom of my heart, representing my institution, I thank all the speakers who took out their time for us and stayed with us as they shared the most important information according to them to all the participants today. So, name by name, the first speaker for the day, Dr. Krishna Ondela, followed by Dr. Priyank Tripathi, and then followed by Dr. Kapil. So you all shared the most valuable information that you have been gaining all these years, and for the benefit of the participants. Thank you once again. As Dr. Krishna is here, sir, thank you so much, sir.
Thank you for giving the opportunity, and the KRP organization as well as the Group Pharmaceuticals. It's a very nice event. I have already seen the feedback given by the participants. It's very positive. They're asking more about kind of activities. So soon we can have more useful workshops for the student benefit.
Definitely, sir. I hope you remember the last word that I used for you. Okay, sir. So with this, we leave the platform, and I once again thank all the participants, all the speakers, all the guests, everybody who made this day a very memorable for every one of us. Thank you.
Thank you. Thank you so much.
Thank you, sir.
And yeah, the certificates, all the registered participants, you will receive your certificates within a very short period of 2 to 3 days. Thank you so much.